Congratulations on taking the next step to finally taking care of yourself, whether that's the joint pain or full body inflammation. Congratulations on taking this next step. What I'm going to do real quickly is go through how to prepare yourself before and even after your treatment with us. Now, you might have already heard from our medical team. If not, our medical team is going to get in touch with you and they're going to basically go over this whole thing all over again. But I wanted to create this for you so that you can start preparing for your treatment. You should have received this brochure. And essentially what I'm going to do right now is go through this brochure with you and help you understand exactly what we want to do before and after the treatments. The first thing that we want to do for ourselves as soon as you've signed up for treatment is start drinking water. You want to be drinking at least 8 to 10 glasses of water before your treatment, and then at least 2 to 3 days after the treatment. And 8 to 10 glasses of water should just be part of your normal regimen. Unless your doctor has said otherwise, 8 to 10 glasses of water is going to really help to drive toxins out of your body and allow this treatment to do that much better for you. So 8 to 10 glasses of water should start the minute you sign up for treatment, and 2 to 3 days after the treatment as well. But again, one thing you can always do for yourself is drink 8 to 10 glasses of water every single day. Should become part of your normal regimen. And you'll see what I'm talking about in this brochure right here. Now, the second thing that we want to start doing is eating what's called an anti-inflammatory diet. What that does is it helps your body to start naturally reducing inflammation by what we eat. And so what we'll recommend is start to eat fresh vegetables and fruits. Now again, if your doctor has limited you on eating certain foods because of certain conditions, please listen to your doctor. But blueberries, raspberries, blackberries are pretty low in sugar, have some really great anti-inflammatory effects. And then eating vegetables, spinach, kale, collard greens, different types of peppers and what have you, is really going to help with down-regulating that systemic inflammation. We want to start doing this right away when we sign up for treatment and making this part of your regular daily routines. Some of the lean proteins also, chicken, let's throw some fish in there like salmon, lean beef, and what have you. We want to start incorporating these things into our diet to help with, again, down-regulating inflammation and for proper muscle and organ function as well. Nuts and seeds as well, walnuts, pistachios, these types of things. Almonds are also very good for us. This is how we want to start building our meal plans. This is how we want to start eating to, again, help down-regulate inflammation and really create some healing within the body, create a really great nourishing the body, if you will. So let's talk about what needs to be avoided before treatment. First and foremost, alcohol, okay? Now our guide is gonna say 72 hours before and 2 weeks after. What I would say is just stop the alcohol as soon as you sign up for treatment. Whether your treatment is next week or 2 weeks from now, it is going to do that much better for your body. I would say stop the alcohol as soon as you sign up, and definitely 2 weeks after the treatment. Our medical team is going to talk to you about stopping something known as NSAIDs. Those are your Motrin, that's your Aleve, that's your aspirin, that is your Advil, those types of medications, okay? At least 3 days before and 10 days after the treatment. Also, steroids. Whether you're on an oral form or in cortisone injection, we're gonna talk to you about scheduling this treatment 14 days after you've had a dose of some sort of steroid. And then we're going to want to hold off on blood thinning agents like aspirin, Plavix, and what have you. Again, our medical team will help you and guide you through that, but that's just something you need to keep in the back of your mind. Please do not stop the blood thinning medications until you've spoken with our medical team. That also goes for any other medications that you are probably wondering about. Definitely wait for our medical team to get in touch with you before stopping anything on your own. I'm just telling you this right now so that you have that in the back of your mind. And again, everything I'm saying right now is on this brochure for us, okay? Now, some other things. right? This is a wellness program. This is not just a treatment. What we like to do here is really create a well-rounded wellness guide for you. Stress is normal for all of us. If you're dealing with exceptional stress, what I'd recommend you start doing is start with some breathing exercises, meditation exercises. What this is going to do is also help with calming down your nervous system before treatment. Go on YouTube, look up some meditation. If you already do meditation, great. These are simple things that we can start doing today to really help with this treatment, but overall help you from a lifestyle perspective. So that's something I'm going to recommend for you guys. Let's talk about after treatment, okay? This is very, very big. For the first 3 days after treatment, just take it easy for yourself, okay? We're going to say, hey, you need to sit at home for 6 to 8 weeks and not move. Well, you need to move. But for the first 3 days, let's just take it easy. Let's not overdo anything. After that, we'll start with some gentle range of motion exercises and what have you. And then after 2 weeks, let's return back to those low impact type of exercises, swimming, golfing, pickleball, what have you. So guys, remember, this is a regenerative process. This is not an overnight success. This takes time. Everybody's gonna heal at different rates, okay? Everybody's gonna respond at different rates. Most people will start to feel something between the weeks 4 and 6. I have seen some people where it takes 3 months to start feeling somewhere. For my neck, it took me about 8 weeks to start feeling the relief that I was looking for. We've had some patients where even, believe it or not, depending on the level of degeneration, it can take up to 10 months. So it really just depends on level of degeneration, level of illness or inflammation, and what have you. The point I'm trying to bring to you is that this takes time. It's not an overnight success. Be patient with yourself, give yourself grace, do the things we talked about in here, and lean on our medical team for anything that you might need. I'm very excited for you that you've taken this step for yourself. I'm really excited to hear your success. Thanks so much.